Hey, Dr. C here with you. Let's talk about how to treat Graves' disease naturally. So it makes perfect sense people would want natural treatments because Graves' disease is scary enough by itself. You're being told you've got to take a radioactive medication. You might need long-term treatment from that afterward. Perhaps you need surgery. And even the name itself is scary. I mean, really, do we have to call it Graves'? In other parts of the world, we call this von Basedow's disease. Now, diseases are named generally after a doctor who discovers them back when, so it was a Dr. Grave. But I mean, come on, Grave? That's scary. And then hyperthyroidism creates natural feelings of anxiety and panic. So altogether, it just makes sense that someone with Graves can be concerned and can look for safer, gentler ways to go about managing all of it. So the important point to realize is that Graves' disease is a big deal. It's something that thankfully is very reversible. The vast majority of people who have it can have it go away in a year and a half if they take the right steps. But you can't ignore it. You can't hope it'll go away on its own. And honestly, any treatment you do is probably better than no treatment. So that's the last thing I would suggest, and that's not a natural way to go about doing it. So yeah, do something, and there are some safe ways to really help with it. Graves' disease causes a lot of severe symptoms. I mentioned the anxiety. Along with that, one's heart can race. They can lose muscle tissue, feel weak and tired. They can get tremors. They can have the eye pressure, the eye bulging. And sometimes these are not as obvious, but when it gets bad enough, they're pretty apparent. They're things that can cause a pretty big change in the quality of one's life. And they know they've got Graves' disease really from getting this diagnosed. So those are some of the symptoms that often lead someone to get checked out. Unlike hypothyroidism, Graves is something that is not as subtle for as long. So generally when someone does have it, the blood levels are more clear and the symptoms often are more obvious as well. So there's not as large of an audience that has milder symptoms and no clear diagnostic picture. In most cases, it is obvious what is happening. And how common is this? It's pretty common. And there's actually some age and gender groups in which it's more common than hypothyroidism. We think somewhere around 6 million Americans have it, somewhere around 2% of women, maybe 0.2% of men, and it can be quite common in some groups. Now, the typical treatment approaches involve radioablation, so using radioactive iodine to destroy the thyroid, or thyroidectomy. In most cases with conventional treatment, they will start with medication to slow the thyroid, but expect to rather quickly do one of those other more permanent treatments. Now, this approach is not taken in most of the rest of the world. What happens is that the more overactive your thyroid is, the more it stresses your immune system in ways that cause it to become overactive. So how does this work? Well, the thyroid has a receptor that becomes aware of TSH. So that's thyroid stimulating hormone, and it's a signal from the brain that tells the thyroid to work. And the thyroid says, oh, there's TSH, I'll put out some hormone. That's all good. Well, the problem is that there are immune cells, abnormal immune cells, that can trigger that same receptor. So your thyroid thinks they're TSH, but they're not TSH. Your body has quit making TSH because there's too much hormone. But this thyroid stimulating immunoglobulin, or these thyroid receptor antibodies, they mimic the effects of TSH. So your brain knows there's too much hormone, and your brain is not asking your thyroid to work. But as far as your thyroid can tell, it's being yelled at, it's being told to work, so it cranks out extra hormone. Now, the vicious cycle is that extra amount of thyroid hormone, that stresses the immune system. And it does so in ways that worsen the attack against that thyrotropin receptor. So this all comes down to the process of taking iodine into the thyroid. So that's the first step in the whole assembly line. Iodine is brought in, and the more that there's engagement of the thyroid via TSH or via these thyroid stimulating immunoglobulins, the more iodine is sucked into the thyroid. So I want you to hear that. It all is based upon how quickly iodine gets in. Because of that, the most blatantly obvious thing you can do to help with Graves' disease is to lower iodine intake. The less extra there is coming in, the less extra hormone the body can make. So that's one of the most important natural steps. And I talked about this in the thyroid reset diet. Now, because extra thyroid hormone triggers the immune system to make extra thyroid hormone, it can make a vicious cycle. And in those cases, lowering the iodine, some cases that's totally curative. But there are those to where it requires something to slow the thyroid in addition. Once the thyroid has slowed down, it gets a whole lot easier. I think about like if you've ever ever had to push a car because you ran out of gas, it's really hard to get the car moving. Once it's moving, it's still hard to keep it moving, but it's a whole lot easier than it was to get it started. And that's the way it is for slowing the thyroid. It's really hard to slow it down. Once it has slowed down, it's not that tough to keep it slowed. So it may take more than diet to slow it, but in many cases, diet can do a lot to stabilize things once it has started to slow down. So there's two big categories of treatments we think about. There's those that basically stabilize the thyroid and those that then slow it down and lower its production. The natural compounds really do well in the stabilizing category. There's a lot of natural things that stabilize it and they help Graves' disease reverse. They can lower these antibodies, they can make the extra hormones less harmful, and they can also help the things that slow the thyroid to work better. Here's a couple of the top ones and a few notes about them. One is quercetin. This is a bioflavonoid first found in oak bark, also known as Quercus alba, thus the name, and this has been shown to help the liver clear thyroid hormones more quickly. And it actually works a lot like propylthiouracil in that regard. So here's a neat point is that many have heard that and thought, does that mean quercetin will slow my thyroid if it's working normally or if it's too slow? And thankfully, the answer there is no. In theory, if you were to consume huge amounts of quercetin, that might be possible, but quercetin is not all that soluble. There's almost like a built-in safety mechanism. You can't get all that much into your bloodstream. So you can get enough to help regulate when there's excess hormone, but you really can't get enough to slow when there's too little hormone or normal amounts of hormone. Carnitine is another one that comes up. This is a conditionally essential amino acid, meaning that the body can make it, but not always. It's useful here because it can help to lower many of the symptoms of Graves' disease. One study showed that within a 2-month time period, the use of it helped symptoms like palpitations, the tremor, the nervousness go down by over 3-fold. So it greatly improved treatment outcomes. Another here is Melissa officinalis, also known as lemon balm. This is a cool thing. It's a relative of mint. And this has been shown to be effective for making those immune cells, those aberrant autoimmune cells, not stick to the thyroid. So it lowers the whole autoimmune process with the TSH receptors. It's also been shown to lower the risk of damage to DNA for those that do radioactive iodine. So the radioiodine ablation, it has a place. It can be totally appropriate in some circumstances, but it's not free of risk. A recent paper shown that it can cause adrenal cortical abnormalities afterward, but for some time we've known that it can raise the risk of several different types of cancers. So it is nice to lessen the damage from it if one does need to undergo it. Another great natural compound is rutin. This is a cool bioflavonoid, and this has been shown to help clear extra thyroid hormone and also help stop damage to lipid peroxidase that occurs from its presence. Then we think about things that have specific protectant effects on the body against the excess of thyroid hormone. Big one here is CoQ10. So a lot of the harm of hyperthyroidism comes from cardiac damage. Thyroid hormones stimulate the heart, and you need some of that, but too much and they damage it. CoQ10 can stop some of that damage and lower the risk. Next up would be selenium. So lots of good data showing that selenium can help reverse Graves' disease more quickly. It can help medications work better, and it can lower the risk for thyroid eye disease. We called this Graves' eye disease in the past. We now know that it comes from not just Graves' disease, and it's not just from too much thyroid hormone. So thyroid eye disease, it's an autoimmune disease in which the immune system builds up extra fatty type tissue behind the eyes and causing them to protrude. It often overlaps with Graves' disease, but the one doesn't directly drive the other, which is kind of interesting. Other protectants against hyperthyroidism, vitamin C has good data about that. It's been shown that it also lowers harm to the body overall and specifically against issues from Graves' eye disease. And this occurs only when we're talking about vitamin C that's a little above what you would get in typical dietary amounts. Now we think about thyroid blockers. How do we block the thyroid? Well, the main things there are medications, and the main two are propylthiouracil and methimazole. Now, these are not considered natural treatments. Propylthiouracil is a naturally occurring compound. It's actually found in some foods. So one could easily argue that that's a natural treatment. Now, methimazole is a modified form of propylthiouracil. Nothing's been added, but a lot of parts of it have been taken away. So it's also naturally occurring. It is found in that form of propylthiouracil in some foods. These are medications, and when someone talks about wanting to do natural therapies, their biggest concerns are often avoiding radioactive iodine. That's often the most pressing issue. And for most people, that is a possibility. There are those that do require medications at first to slow things down. There are natural compounds that work similarly that can help someone need less medicine or need medicine for a shorter duration of time. And two that are well used or have been well used include lithium and fluoride. Now, I hear the boos and the hisses. Lithium and fluoride, those are minerals that have a bad rap. Those are things that we think about, not wanting too much of or wanting to avoid. And valid concern, but think this through with me. So the main drawback about both of those minerals is that they slow the thyroid. They can cause hypothyroidism. And there are other side effects they can cause for sure, but the first side effects that emerge at the lowest doses are hypothyroidism. Now, we're talking about hyperthyroidism. We want to slow the thyroid. So arguably, these can be used specifically to deliberately slow the thyroid in conjunction with other approaches. Now, lithium and fluoride, there are some versions of them that are available over the counter. They're usually not enough to make a difference. So like lithium orotate, that's found in milligram or microgram dosages. I won't talk about its efficacy, but those are non-potencies that can make a difference for thyroid function. These are really things that would be used in the hands of a natural prescriber that is familiar with using them in the context of treating Graves' disease. And, I've done this a lot over the years, as have my doctors. These are really good adjuncts. And for many people, they don't need to use much, if any, of methimazole if these are available. So they're basically ways to help speed that process. With a low iodine diet, with those other natural compounds, they can be very good treatment options. One last thing to mention as a natural treatment option, iodine itself. So this is not something I recommend, but I want to just talk about it because it has been mentioned before. So iodine, remember, it's the stuff you make the hormone out of. Now the paradox here is that a whopping dose of iodine shuts off the thyroid. It's almost like you want to turn off the lights, so you put so much current in the house that you blow the fuse box. You'd get the lights to shut off. You might burn down the house, but you'll get the lights shut off if you did that. So yeah, that's kind of like using iodine. And it's a pretty good analogy because it's consistently effective for slowing the thyroid, but it could create a risk of a thing called thyroid storm, which is kind of like the house burning down. It's just massive amounts of thyroid hormone being dumped out of the thyroid, like possibly fatal massive amounts, like that much. There was a recent study about using iodine for Graves, and they had a few people that had a decent duration, and overall it did seem to work well, but it wasn't with enough people or enough duration to see if it would have caused thyroid storm. So it can work, but it's not recommended. We're just not sure about the safety of that. But we do know that there are safe, natural ways to help Graves. Biggest thing is managing the diet. Take a look at the ideas in the thyroid reset diet and think too about other sources of iodine. So think about the cosmetics, the supplements, and yeah, cut those things down. All your efforts will go so much easier. The take-home message is that if you can stabilize thyroid levels, 90%, 90 to 95% of Graves can reverse within 18 to 24 months. So this is very treatable and very reversible. However, it's also very serious. We can't ignore it. We have to make sure it's progressing and moving in the right direction. All right, take great care, and I'll talk to you again really soon. Bye bye.